Ovarian cancer, BRCA mutations, and port use for chemotherapy. Ovarian cancer is a disease where malignant cells are found inside, near, or on the outer surface of the ovaries. For women between the ages of 35 and 74, ovarian cancer is the fifth leading cause of cancer-related deaths. It is the most deaths of any cancer regarding the female reproductive system. The risk of a woman developing invasive ovarian cancer is 1 in 78. The highest rates of ovarian cancer are in women aged 55 to 64 years old. Treatment plans depend on the type of ovarian cancer, its stage, and any special circumstances. Local treatments attack the tumor in a specific area without affecting the rest of the body. These include radiation therapy or surgery. Systemic treatments are any drugs that are used to treat the ovarian cancer. These chemicals can be taken either by mouth or infused directly into the bloodstream. Many different types of medical personnel help with treatment. These include gynecologic, medical, and radiation oncologists, physician assistants, nurse practitioners, nurses, psychologists, sex counselors, social workers, nutritionists, genetic counselors, and other health professionals. BRCA is a gene that produces tumor suppression proteins. Mutations to the gene can result in inadequate production, leading to increased susceptibility for tumor growth. Approximately 1.3% of women in the general population will develop ovarian cancer. However, 44% of women who inherit a harmful BRCA1 mutation and about 17% of women who inherit a harmful BRCA2 mutation will develop ovarian cancer by the age of 80. Treatment options for people with BRCA mutation include prophylactic surgery and chemoprevention. One type of surgical procedure that is often done is called bilateral prophylactic salpingo-oophorectomy. This procedure removes the ovaries and the fallopian tubes. Some drugs that are given prophylactically include tamoxifen and raloxifene. A port is a small drum made of plastic with a thin tube going from the drum into a large vein above the right side of the heart. It's usually placed on the right chest wall. The drum is accessed by a nurse with a special needle called a Huber needle by puncturing through the skin into the septum of the port. These are also known as port-a-cath, barred port, passport, metaport, and infusaport. Ports are used to get more than one drug going at one time, to allow for continuous infusion, to hydrate patients, to allow for frequent infusion treatments, to administer blood products, to allow for blood draws, and to prevent damage to veins or tissue. Ports are inserted in the outpatient setting, and the procedure takes place under conscious sedation. You might expect mild pain after placement. After the port has been inserted, keep the dressing dry. Do not perform any heavy lifting until the incision is healed. You may resume normal bathing once the dressing has been removed. Call your health team if you notice any pain, redness, or drainage at the site, or if you have any fever or chills. When you're done with treatment, the port should be flushed monthly for maintenance. Thank you for watching, and we hope you have enjoyed our presentation.